Hi, I'm Dr. Amy White. I'm one of the dentists from our team at Avondale Dental. We've been based in Avondale for over 30 years and we're quite a big part of the community. We treat people from all over Auckland and we always try to treat people as we'd want to treat our own family members or ourselves, so we'd really look forward to welcome you to our practice. So often with broken teeth, if it's a small break in a tooth, we can usually repair that with fillings, but when it's something that's quite large, you've had a big filling in a tooth before or a large portion is broken away, then we usually do need to place a crown on that tooth to better protect it. If we try and repair it with a filling, it's almost like just a patch up. It's a very temporary measure and the tooth usually breaks again and ends up going to need a root canal, needing extraction later on. So putting a crown onto a broken tooth is usually a very sensible way to keep that tooth lasting for the long term. If you imagine almost like a thimble slotting over the top, it's a casing that fits over the tooth, encircles it and provides a lot more strength and structure and integrity. Fillings and teeth usually just sit in the tooth itself and they don't do anything to strengthen it, whereas a crown or a cap, by sitting over the top of the tooth, it holds it all together. Crowns can last for a very long time, especially in comparison to fillings. We do guarantee our crowns for 5 years for any technical defects or breakages, but we usually expect our crowns to last in excess of 15 years, and sometimes we're even seeing crowns lasting for over 20 years. So they are usually have a very long lifespan.
Previously, I've been to see many dentists. I had work done overseas, which was diabolical, and that led into the first reason that I came to see Amy. I'd been to see quite a few dentists to get quotes as well for my dental work, and they were all around the $20,000 to $30,000 mark, and I just couldn't face it. Everything's streamlined. I come in for the appointment, it's painless. Then I wait with a temporary crown, and that never falls off. They ring me every single time, every single day after I've had my treatment. They ring me, how are you going? And I never have anything to report. There's never pain.
When you first come to Avondale Dental, you'll be greeted by one of our lovely receptionists. They'll welcome you to the practice and usually ask you to fill in a new patient form if you haven't already been in before. After that, you'll come through to see the dentist for a consultation, and we'll assess what the problem is, see the condition of the tooth, do a few x-rays or tests if needed to make sure that the tooth is strong enough to support a crown and that no other treatment's needed beforehand. From there, we see you for a preparation appointment where we have to remove any old fillings in the tooth, any cracked areas, make sure that we've got a strong foundation to work with. Once that's been done, we take a copy, or what we call an impression, of the tooth and take that to our technician. She then scans that into our computer software and uses the computer to design the crown to fit the tooth perfectly. It's then milled by a machine which is connected to that computer, and from there the crown is polished and what we call glazed, made to look like a tooth, and we see you to glue that into place, and then the tooth is all nicely protected.
I'm always amazed every single time I pay the bill. I think, I wonder if they're going to put their prices up. I really do. I think that is amazing for their level of skill and care, the technology I see at work, the premises, just the people that I'm seeing and the service I'm getting. I'm always amazed at how inexpensive it is.
The whole process to make a crown can be done in the same day. We see you for an appointment to prepare the tooth initially, and then we do need a few hours so our technician can make the crown and mill it and make sure that it's looking beautiful before we see you the second time to glue it in. As said, that can be done on the same day if it suits your schedule, or we can make it a few days later if that's easier on you. And we leave you in the meantime with a temporary crown in place just to make sure the tooth's covered and protected. For anyone who does have an emergency, say they've broken a tooth and it does end up needing a crown, we do try our best to see people on the day that they call if possible, and even if we can't do the full preparation or get the crown on straight away to protect the tooth, we can often do other measures to make sure that you're comfortable and pain-free until such a time when we can prepare it properly for you.
Yeah, I just feel like I've joined the awesome adulting people that have always looked after their teeth.